Contagious viruses are concerned, the NICD says no cases of monkeypox has been detected in our country. Of course, urging anyone with developing symptoms to report it to healthcare professionals. So let's find out where we are on this. The World Health Organization said no need for mass vaccinations at this stage. SA Medical Association Chair, Mr. Mvuyisi Mzukwa, joining us this morning. Mvuyisi, good morning to you. So let's just first of all start off with the good news, at least for now, that there's no monkeypox in South Africa. What is it? Good morning.
Good morning to you, Gareth, and good morning to your viewers, and thanks for having me. Yes, indeed, it is a good news that we do not have a case at the moment. But remember, Gareth, we're living in a global village. Just recently we had COVID-19, and we thought China was too far from us. But we know now that, China is our neighbor. And, it's easy to get infections. I mean, more than 14 countries already are reported to have cases of this virus, even though there's nothing to be scared about. But just to know that there are cases of this nature that could, lend itself to our shores.
Can we just talk about transmission and symptoms very quickly as well? Because we're talking, it seems from what I'm read up on this, it's very much the same procedures. Wash your hands, be careful, wear masks, that sort of usual PPE that we're all used to because of COVID-19. How is this monkeypox transmitted, Mvuyisi?
Originally, it's a viral zoonotic disease. In other words, it comes from the wild animals. Then to humans, obviously, human to human is through droplets, large droplets, by the way, and physical contact, bodily fluids, also infected or contaminated material, including bedding and surfaces. You get myalgia, in other words, pain, general body pain, severe headache, you get a fever, but also there's a distinguishing factor where you get swelling of the lymph nodes and a rash that starts from the face and spreads out, including your palms, your soles, your genitalia, your mouth. These are big vesicles, about 1 centimeter in diameter. They usually have water inside, but may tend to pass, and it may be itchy and painful as well.
So are we going to end up in a situation where we could find that there are carriers, Mvuyisi, who are asymptomatic, very much like the problem we had with COVID-19 in the early stages of COVID-19, asymptomatic people walking around and infecting others because they don't know they have it? Or if you have it, you will definitely show symptoms?
No, at the moment, there's no evidence that carriers, if people who are asymptomatic may transmit to other people. And remember this, in most cases, you must be symptomatic and, have vesicles that if they erupt, that blood or fluid gets out with the virus. So there is no evidence at the moment. So very important, though, that we keep that social distance if we suspect that one is infected with this viral infection.
As we saw with COVID-19 as well, and I'm sorry to keep going back to COVID-19, but I think it's the example most people, in fact everybody, will be familiar with, Mvuyisi as well. Mutations. Are we going to, like we did with COVID, we started with alpha, we went to beta, we skipped a few letters, we ended up with delta, etc., etc. Does this monkeypox mutate? Is there evidence that it does do that?
Well, every virus is capable of mutating. But, what we know for now is that this is responsive in terms of the vaccine that was used long time ago in 1980 with the smallpox that was eradicated. So that tells you that even though there might be mutation, it's not as fast as we see with COVID-19. But there is surveillance that is going on. They are going to determine the genomics around it to advise accordingly.
Are there vaccinations and or cures available at present for this?
Yes, the smallpox vaccine that was used a long time ago in 1980 is effective with this viral infection, monkeypox. And there's another newer version that has been developed, I think, in 2019. And there are also antivirals, though I'm told that they are still in Europe, that are very effective with the virus. So I think there's no need to panic. But on top of that, Gareth, this is self-limiting. About 2 to 4 weeks, you get rid of the virus. You know, there's really nothing to panic about.
I was going to ask you, as far as how long it stays in your system, do we have numbers on mortality rates as I say goodbye to you?
Yes, it is estimated to do about 0 to 11%, especially among young children, but also those are immunocompromised. So those are the people that we should always be worried about.
And perhaps let me leave this as my very last question, Mvuyisi, before I say goodbye. What is government and your organisation doing at the moment? Are you communicating? How concerned is the SA government?
Well, what we are doing as the South African Medical Association is that, we are asking our members to be vigilant on the ground, because you know that it lends to healthcare professionals before it is noted by NICD, because we alert those people what is going on the ground. But what we ask for government is that they need to prepare themselves, to curb this and protect those that may be vulnerable in terms of, making sure that if there are cases.
And that is a real shame. We lose Mvuyisi right towards here, but I do think we got exactly the gist of what he was saying as far as my question around government and the South African Medical Association was concerned. My thanks to the SA Medical Association Chair, Mvuyisi Mzukwa, joining us, talking about monkeypox. So it looks like it's very similar strain to smallpox. There are vaccines currently available for it. No cases in South Africa, so if you are worried, I'm sure we all are off the back of COVID-19. No cases in South Africa at the moment, but they are watching very, very closely. Of course, we're going to stay on top of monkeypox, try and keep you in the loop with the very latest developments. All right, coming